coordinate work, and she, it's really hard for her to talk. But I'm going to just quickly give you her story, and then she's going to do a Q&A. She's going to answer your questions, okay? So I made an outline so that we can keep it quick, because we want to eat. Right? Okay. So I'm Dr. Jonathan Mills. I am a licensed psychotherapist. Psychotherapist is one word. If it was two words, you wouldn't want to believe anything I say, because then I'd be a psychotherapist. Yeah. So she had 10 back surgeries, and both of her SI joints are fused with 3 rods. And before she got done, everything in her back was solid metal. With the screws are about this long. We should have brought it. We forgot to bring it. Eventually, all of the joints in her back were fused, and their last surgery, they took all the hardware out because it's no worse. And it's the worst surgery that she had. So why are we here? First of all, I've never been to his seminar until today. So her surgeon said to her, "I've looked at your x-rays, there's nothing I can do for you, goodbye." This is the guy that did 10 surgeries. He excused her as a patient. "I'm done, I don't know what to do for you." Okay? She goes to her pain doctor, and he's been giving her injections and whatever, and he eventually says, "There's nothing I can do for you, goodbye." Her primary care doctor did a CT scan, and we found additional problems which we just presented to them, and they're starting another round of interventions to deal with this new problem that we didn't have when we first got there. Her primary care doctor says, "I've looked at your CT scan and there's nothing we can do for you, goodbye." How would you feel if your 3 major doctors that you've been depending on for years excused you as a patient? Okay? So we're stuck, and she's in pain, a lot of pain. So how did we get here? We have a neighbor who's a friend who was told she needed knee replacement surgery, and she says, "I don't want to do that." She found Dr. Yu. In 6 months, she's bowling every Thursday night. So she told us about Dr. Yu, so we showed up. Never met him before, never been to a seminar. We walked in cold, had an appointment with him, and we signed up in 10 minutes. Now, I told you I'm a psychotherapist. I read people for a living. Okay? This guy is the real deal. I'm just going to tell you. I thought I was going to have a lecture from a used car salesman and really put the pressure on us to do this. Nothing like that happened. He explained what he did. It made perfect sense, just like what you heard. And we signed up last May, and I'm going to let you tell her how she's doing. The treatment plan is customized for your situation. Everybody is different, okay? So it's not a one-size-fits-all. And you need to give them feedback on what seems to be working the best for you, because there's many different treatment modalities, and some seem to work better than others for her. So we were looking for 50% reduction. We said if we could just get 50% reduction in pain, we'd be home free. On a pain level of 0 or 1 to 10, she was running an 8+ every single day. 4 years.
With medication.
With medication. Now, she is on Percocet. Do you know what Percocet is? It's OxyContin and 325 milligrams of Tylenol. She's been on 10 milligrams of OxyContin for years. My wife's a drug addict. Okay? Now, because of this treatment, her pain is greatly reduced. I'll let you ask her, and this month she's reduced her dosage from 10 milligrams to 7.5, and it's going great. Next month we're going to reduce it to 5, the next month we're going to reduce it to 2.5, and we're going to get her off of OxyContin because of Dr. Yu.